Hi, my name is Dr. Bethea. I'm the physician owner for Greensboro Rejuvenation, the Center for Integrative Health and Wellness. In today's video, you'll see me as a patient undergoing PRP, which stands for platelet-rich plasma treatment for hair restoration and scar tissue management. This will be performed by Bradley Hicks, my physician assistant. So PRP, platelet-rich plasma, is very useful for pain management in the joints, soft tissues, the spine. It also has indications for hair loss, for volume restoration, also useful for scar tissue, stretch marks, and even for sexual health and wellness. Before you undergo a PRP treatment, there are some protocols that you need to follow. First, if you're taking any type of anti-inflammatories, things like Motrin, ibuprofen, Aleve, Mobic, Celebrex, all those particular medications must stop because they interfere with how the platelets combine with each other. If you take aspirin-containing products, those will also need to be discontinued as well because the aspirin interferes with the platelets combining together. If you are taking a blood thinner, you will need to have permission from your provider to come off of that before you can undergo this treatment. Your cardiac health comes before elective PRP. If you are currently undergoing chemotherapy or radiation for cancer type treatments, we will need your oncologist approval before you can safely undergo this type of procedure. Any type of natural anti-inflammatory such as OPC3, turmeric, antioxidants such as vitamin E, vitamin C, those will also need to be discontinued because they do interfere with the PRP process. So if you are undergoing PRP specifically for hair restoration, please do not get your hair done the day before because you will be wasting your money. Wait to get your hair done about 48 to 72 hours after you've undergone the procedure. If you are undergoing PRP for skin restoration, please make sure that you do not wear makeup. Make sure that all jewelry is removed. Do not wear any types of lotions or perfumes as these can interfere with the procedure. If you're undergoing PRP treatment for hair restoration or any type of skin rejuvenation, please make sure you bring a wide brim hat to the procedure so that your head is covered and your face is covered as well. Do not remove the PRP from your hair or your skin for 8 hours, so resist the urge to shower or clean it off your face. It must stay in place for at least 8 hours following the procedure. The first part of undergoing PRP treatment is obtaining the blood itself. That typically involves drawing up between 20 cc's to sometimes 60 cc's depending on the type of procedure that you're having. In the case of today's video with hair restoration and skin rejuvenation, we will draw up 40 cc's of blood. Once all that blood is drawn up, it's placed into a special tube and those tubes are transferred to the centrifuge. When they're in the centrifuge, they spin for about 9 minutes. They're then removed and the platelets and the plasma are separated from the whole blood. After they're separated, they're combined with the lidocaine, usually about a 2% solution that we use for anesthesia purposes, but we also combine that with calcium chloride. And the purpose of the calcium chloride is to be a kickstarter to the healing process and pain relieving process itself. That compound itself is what's used to inject into the scalp and into the face for today's video. We will numb up the skin, in this case the scalp as well as the face, with a topical solution. Benzocaine, which is a 20% solution, lidocaine is 10%, and tetracaine 10%. And it does a really good job with numbing the areas that need to be treated, specifically in the face. For the case of the scalp, we do an additional level of anesthesia, and that is a combination of lidocaine and epinephrine. The purpose of the epinephrine is to keep the lidocaine directly in the scalp where you need it, and we also combine it with sodium bicarbonate, and the purpose of the sodium bicarbonate is to reduce the burn to the patient, and you will appreciate having that mixed in with the lidocaine. You can also feel some jitteriness as a result of epinephrine itself. So you want to make sure you just stay away from caffeine that day, otherwise that will increase your jitteriness throughout the day. Also used with hair restoration is niacin and Panthenol, And the purpose of these two medications is to help your hair follicles open up more. We call it vasodilation. It opens up more to accommodate more PRP directly into the shaft of the hair. Now, some patients can actually feel a flushing response where your face, your neck, and sometimes even the chest can be warm and red, but it's just a reaction to the medicine and will resolve on its own. After the scalp is numbed with the mixture of the lidocaine, the epinephrine, and the sodium bicarbonate, it's time to activate the PRP. When we talk about activation, we talk about officially combining the calcium chloride with the PRP. Once it's activated, we only have a limited amount of time to get that to the areas where it's needed. Because of that, we divide it into multiple syringes so that we're able to preserve all of our PRP mixture. That PRP is then injected underneath the scalp, and then we use what's called a nanopen, where we paint the PRP directly on the areas of the scalp that are deficient in hair, and the nanopen penetrates that topical PRP directly into the scalp. The second part of our video today covers PRP treatment for scars, specifically in the face and underneath the chin. The process is a little bit similar to the scalp in the fact that we do paint the PRP on the face with a fine brush, and we use the nanopen with typically a bit more of a depth to it than we do for the scalp, but it's the same purpose with penetrating the PRP directly into the areas of the skin where there are scars, and that's typically done about 2 or 3 times to make sure the areas of the face and underneath the chin are appropriately treated with the PRP. Things to follow once you have undergone PRP treatment for whether it's hair restoration or skin rejuvenation is the following. That hat that we told you about in the beginning, you're definitely going to wear that to protect your hair and your scalp and your face from the sun. You need to stay out of the sun for at least 8 hours so that the PRP can do its work without any interference. Those anti-inflammatories, try to resist the urge to take those for the next 3 to 5 days, because the anti-inflammatories unfortunately still do interfere with how the platelets combine together, so avoid those as much as you can. You can use ice to the areas of your face and your scalp, but again, ice can sometimes interfere with the combination of the platelets, so try to avoid that as much as you can too. If you need to, you can take some Tylenol for any type of injection site soreness. Patients who are taking aspirin, we will have already had your clearance for you to continue not taking these for the next 3 days, but after that point, you need to go back on your blood thinners as directed by your provider. If you have any questions about the content that you saw in the video today, please do not hesitate to contact us. Our office number is 336-501-3796. You can also shoot us an email at info@gsorejuvenation.com. And of course, check us out on our webpage, gsorejuvenation.com. You can also follow us on Facebook and Twitter. You'll be able to see before and after pictures of patients who have undergone successful PRP treatment.